Welcome to True Health Tuesday, and the truth will set you free. Okay, I actually had a couple of cups, sent to me with that, and it's pretty neat. Okay, so here's the evolution of this. Okay, now I'm a chiropractor. The people of cultural authority, typically think that we're back pain and neck pain doctors, even though we're not. We never have been back pain or neck pain doctors. Just when a group of prostitutes got together in the 70s and decided to have us accept insurance. So then they said, okay, you don't need to be real doctors of the nervous system or alter autonomic function. As long as you just were really happy with uncomplicated low back pain, then you can accept insurance. Okay, that's where the prostitution came in. Okay, now I started this by looking at the opioid crisis. Now, if anybody knows that is the biggest crazy insanity, it's like there's too many opioids. It's killing thousands of people. 130 people a day are dying from opioids. Doesn't it make it sound like, little kids are getting it from smoke shops or something? Okay, no, this is an utter failure of the medical system to completely recognize that there's an actual problem that can't be corrected with pharmaceutical products. And in fact, the more pharmaceutical products you throw at this problem, the sicker people get. Okay, and wait till you see the World Health Organization is getting behind it. So I'm going to show you how to correct low back pain, but first you gotta freaking find it. Okay, so this is the cause and solution. You got to look for a mechanical cause. Honest to goodness. I mean, there could be a tumor, which is about less than 0.1%, but you've got to look for a mechanical cause. Now, that's a problem in itself, because if we only have a chemical solution, what type of drug? Doc, you're pretty brilliant. What type of drug will correct a reverse curve in the spine? Oh, there isn't any. Okay, so we got it good. If we got a mechanical cause, we should have a mechanical solution. Okay, so you got to look for the solution, and you need an objective analysis. That means if you're using how do you feel as your guide, that's insane, because you're only aware of 10% of the nerves that come off the spine. But in modern society, it's how do you feel? By God, get that instant result. That's why opioids are so wonderful. You have to use an objective analysis to gauge your care. You have to identify the cause. And correcting the problem also corrects the secondary effects. Now, what do I mean by secondary effects? Well, chronic pain shrinks the brain, and that's similar to aging and Alzheimer's. But also, chronic pain... Did I just yell you? Okay. You betcha, So I stimulated an emotional stress response which elevated heart rate, elevated blood pressure, shut blood supply down in the gut. What do you think back pain does? That's not secondary causes. So these are people misdiagnosed with type 2 diabetes, digestive disorders, inflammatory bowel syndrome. Chronic pain is going to cause digestion issues, depression. I mean, it's psychotic to think that we can give an opioid and correct everything else. And then what are you told? You're pre-diabetic. You're pre-hypertensive. Hell, everyone here is pre-dead. So it's kind of like stupid to start this stuff off. So everything's going to initiate this autonomic response. So does that mean everybody with high blood pressure or high cholesterol or some type of digestive disorders has an autonomic imbalance? Yes. The body is intelligent. It's self-healing and self-regulating. You show me somebody that's got inflammatory bowel or high blood pressure and they're not in a sympathetic dominant state. I would love to see it. I've had people missing kidneys, shot in the kidneys, and that's a main blood pressure regulator, and they can still regulate their own physiology. So this is how you identify the mechanical problem, which is usually low back pain. You have to take stress and static x-rays. What is that? I'm going to show you. But when you're standing, you're weight bearing, you're taking a picture, and then you're going to bend to see how the structures move. Now, 50% of low back issues are from the neck. Remember, 90% of the nerves that come off the spine, there's no pain fibers. But you got a 12 to 15 pound bowling ball on the end of 7 little tiny bones. If this baby is forward or off to the side, do you think, anybody in here have a sledgehammer? Okay, hold it down here and lean it forward an inch. What's the low back going to do? And also, if you've had a long-term low back issue, the body is going to adapt. If you've had one trauma, then your body is going to shift and adapt to those altered biomechanics. So you literally, by correcting the problem, you have to alter the brain's awareness of itself. You're changing proprioception. And then restore the altered mechanics. So think of somebody, walking with back pain. Is that going to change the shoulder, the hip, the knees, the biomechanics of the feet, the calves? Absolutely. But what does, in psychotic world, okay, and I'm talking the standard insurance pain world, you have back pain, we're going to pay for the back. We're not going to look at the flat feet, the bunion formation, the sleep disorders, or anything else that could be associated with that. And then, how about taking a post x-ray to actually show that you fixed something? Okay, where's the gals from Missouri? Show me state, right? I'm totally with you. Okay, so yeah, show me that you fixed it, okay? Or we could take a bunch of opioids and ignore the problem. Okay, so x-ray phobia, I'd encourage you to look at the data behind this, because there's a big movement now. From the medical system. And remember, 86% of the chiropractic colleges are trying to suck up to the tit of the medical world. Okay, they're trying to, be a medical doctor so that you could prescribe stuff, okay? So now, what does the medical world do? They just will not x-ray unless after six visits or 6 rounds of medication that there's no result. Okay, and then they'll shoot an x-ray. So now they're telling this, and it's called the Canadian red flag rules, and 86% of the colleges are going along with it, is that if you have 6 adjustments on someone without getting results, then you can shoot an x-ray. And I'm going, well, how the hell do you know what you're working on if you're working blind? Does that person have, grade 2 arthritis, grade 3? And you know what some people say? I can feel it. Yeah. I work on thousands and thousands of people, and I can't feel it. I like to see if it's grade 2, grade 3, if it's a 15-degree bend, if it's a 5-degree bend. I want to see exactly what the heck I'm working with. So this is a brilliant article by Deed Harrison, and also that most of the chiropractors in the rest of the world can't shoot x-rays legally. So everyone's trying to dumb down the profession to say, look, you don't need an x-ray. Just work on symptoms, okay? So now here's a patient that came in the first part of this week. Today is Tuesday. Okay, that would have been yesterday, okay? Now, you can see that there's a significant lateral deviation, and the lumbar kicks off to the side, then goes this way. Now, when you're looking at a standard medical doctor looking at this, or the chiropractor that doesn't know what an x-ray is, or the physical therapist, or anybody, and the person here, they say, yeah, I hurt here. Do you actually think with all that bending, twisting, and buckling in the rib cage, the thoracic area, forward head carriage, loss of curve, you don't think that those are a contributing factor? It's like, did you lose your common sense? Is the medical training out common sense? But just look at the biomechanics. Say that was a crooked building. Wouldn't you have to look at every little aspect on it? You should. So this is why, when presented with back pain, you got to ask yourself why. And if somebody says, well, it's just wearing out, that's an idiot. Okay, because the body is constantly regenerating tissue. If you understand what the shape of the discs are, what discs literally are, you're looking at 80 interconnecting rings of ligamentous tissue. These things don't wear out. And in fact, when they're under such a huge force loading, there's not a lot of blood vessels to them, but they get their nutrients through movement or imbibition. So now let's say that we take this person here, and now what we're going to do is do a bending film. So what you're going to do is you're going to take that spine and you're going to have the patient standing up. And this is why it's really a challenge, because the x-ray expert or the radiologist has to be, when they're bending, they have to have their hand on the iliac crest. So when it's bending, once that person starts to recruit, then you got to stop. And that's when you got to check it. So what you're looking at these two films here, this is a person bending right and bending left. Do you see this a similar arc on either one? No, it's totally different. Now this person actually had an MRI that showed the L5-S1 disc on the bottom was a problem. Now they got this information from laying flat on a plate with a magnet zipping them around them and a computer interpreting the image. The position of the MRI radically alters what the information is. But again, nobody asked the question why. Why is it malfunctioning? If somebody says old age, punch them. Okay? Because why is the L5-S1 disc older than the L4-L5 or the L3-L2 or whatever? But you can see the bending on that left bending and the right bending. Look literally at the top of the film. How far? They're both bending about the same, aren't they? So there's no way, no how you could possibly see the dynamics underneath it without an x-ray. And what you're looking at here is not a disc bulge. You're looking at alterations of proprioception. Literally how the brain views the body. And this is what has to be corrected. If you're just looking for pain, you're in the wrong field here. So identifying the alteration of proprioception, what proprioception is the body's position in space. Now, attached to this baby here, you have sensors. And these sensors tell the body, or tell the brain where the body is. Now, these sensors are the joint mechanoreceptors in this little joint called the facet, but also the intrinsic muscles, little tiny muscles. They have 4 times the amount of muscle spindle receptors, which is a little tiny thing that communicates to the brain. In here, even the ligaments have sensory components that send signals up to the brain. So if you have trauma here, and you understand that these nerves keep you alive, is the body smart or is the body smart?
Yeah.
Okay, good. Good. I see, I'm making it real easy. Okay, so the body is smart. So you get this friggin' nerve here that supplies the pancreas or the kidneys. So you're talking blood sugar and blood pressure regulation. If this nerve is compromised, that's bad. Okay, it's like crossing the streams in Ghostbusters. So you're going to have, first you get damage, and then all the muscles are going to lock up. Okay, and it's going to limit motion because the body is trying to save the nerves, because the nerves control and coordinate every function. So what you're looking at here is a long-term damage of those nerves and the body protecting it. Now, if it's been going on for weeks, months, or years, that alteration in movement is going to change brain function and literally change physiology. Does that make sense? There is no way you can find this without a stress x-ray. And this is constantly missed, constantly missed. I cannot tell you how many post-surgery cases come in here that are missed. This happens to be the side view, and the people that have seen x-rays before know that most of the curve in the low back is missing on this one. But that big red line is pointing to the descending aorta. And we should not be able to see this. This is atherosclerotic plaquing. This is hardening of the arteries. And if you're curious, yes, they were on cholesterol drugs for about 10 years. And yes, cholesterol drugs do cause hardening of the arteries. So this means that if we can see an artery here, that means all the arteries are messed up. So we have to get them on some way to clean the arteries, typically vitamin C and L-lysine, but we actually have to stop the damage to the arteries to correct it. Does that make sense? So now, knowing that the curve is lost in this person and they have pathology, think of how beautiful this is. What if we were to get the curve back? Now, when I'm opening this, the part or the front of the vertebrae is getting wider, yes? Okay, that's creating a negative pressure. So it's moving the disc material from the back to the front. So guess what happens? In most pathologies, we're seeing a loss of curve. How to correct it? We restore the curve. Thanks for that confident response. Okay, I was the same way in school too. Even if I knew the answer, for God's sake, don't pick on me. I don't want to speak in front of a big group. I'm scared to death. So we have to restore the curve. Thank you. That's better. I know you're still scared. I know. I was the same way, man. Big guys are always the same way. Okay, so when you look at this, it's like, God, that makes so much sense. So how do we start people off? Once we've identified with the stress x-rays, we've looked at the entire spine. So we know that there's a loss of curve, lateral deviation, forward head carriage, so that 12 to 15 pound noggin is a contributing factor. We lay them face down under abdominal suspension. So what's that going to do? It's going to create a negative pressure on the front of the disc, decompressing that joint. Fantastic. And you can see how we're using or flexing the legs, contacting the body to create a negative pressure. Why would you create a negative pressure? Well, think of it. You've got something squished, and the discs have a horrible blood supply. They get their nutrients through movement. So if you can induce movement, then you can have the body correct. Here's the big problem. Remember the bending film? Is that good movement or crappy movement? Okay, terrible. It's horrible movement. So what we have to do is not just get them to move correctly, we have to change the brain's awareness. So this is what the adjustment does. We're literally going to change proprioceptive responses by distracting, bending. But also, remember the different structures involved, the ligaments, the discs. Disc is a ligament. You have to vibrate them, okay? And vibrate at 10 cycles a second. Now, I made, a jigsaw with the furniture in. It has a nice variable speed, 10 cycles a second, loosens up the ligaments. But I got to tell you, to get this body to work correctly, see where those red lines are? Those red arrows are the convexity. Okay, and the way the joint mechanoreceptors work in all the structures inside of the spine is when you've got a lateral deviation, the outside portion of that is going to be tight. And so it drives me crazy when people say, well, gee, why don't you have a massage therapist here? And I said, well, I would, but I'd have to have them working very specific. So I'd have to say, look, at T4, only work on the one on the left. On T8, work on the muscle on the right. And then, and can you imagine laying somebody on a roller table where it just relaxes everything? None of that makes sense. So when we're looking at this, the muscles that run down either side of the spine, they're called postural muscles. You don't have conscious control over it. You can't tighten it up and you can't loosen it up. But if you have an area of a bend where one side is bent and the other side is bent, that convexity is going to be increased in tone. Why? Because when this baby contracts, it straightens it up. So you're going to see increase in tone in all of those areas. So in order to restore nutrients to the disc, you've got to restore normal motion. In order to restore normal motion, you have to change the brain's awareness of that. No, you're supposed to say, wow. Okay, so now, if there's any engineering nerds here, you're like, dude, this is great. Okay? If there's regular people here, I'm sorry. but when you look at it, isn't it cool? It's actually neater to understand that in order to correct a problem, you got to find the problem first. Okay, so this is literally bending to one side and bending to the other. Now it's kind of hard to see because I just took those films that were vertical and laid them down, but this is what we're feeling. When we're actually tractioning and bending, the muscles on the inside portion of the curve should be relaxing. And that's the neat part, is because you're going to find out that they're not. So the body, even though it's passive, laying passive down, and you're bending it to one side, bending it to the other side, those sensors in there, and I'm talking the ligaments, the intrinsic muscles, the joint mechanoreceptors, they're all sending signals up to the brain to increase or decrease the tone of the muscles. So this is where you're going to vibrate, traction. Then all of a sudden you're going to see a normal force loading or normal response to the force loading that you're given to the spine. Does that make sense? Okay, then the cool part comes. This is when you're going to do what's called a drop, which actually, it's a drop table technique, which drops down about 1/2 inch. And Newton came up with a cool equation. Force equals mass times acceleration. I like it a little bit easier. For my brain, it's understand than Einstein's, which is energy equals mass times the speed of light squared. Okay? I like the force equals mass times acceleration. It makes sense. So this way, the mass that you push, or how hard you push, the force generated is also based on the speed. And the drop tables that we use are very fast, so we don't have to push that hard. Why do I like that? You know, when I was a single doctor here, I was seeing about 250 people a day. And you do that year in and year out, it tends to wear on you. And it's also, if you have to push harder on the patient, it wears on the patients. So this way it makes everybody easier. So once you get that they're working correctly, where you're seeing the biomechanics work correctly, you do the drop. Then you put the person in a side posture. So what just happened there? The face is down. That means the entire body or stimulus to that brain is with that face in the prone position. You put them in the side posture, the brain is in a totally different attitude, and then you're doing adjustments without torquing or rotation. And you'll see this happen a lot in a lot of osteopaths, some chiropractors' offices. Well, they'll turn the hip really far, and they'll turn this really far, and then they'll hook the leg up like this and twist you like you're, chubby checker doing the twist, okay? Well, guess what that does? Like, and all the doctors watching this, okay, try it. Lay somebody in a neutral position on their side, and then lift the leg like you were taught, and see what the muscles do. Or put your hand on the spine and torque the body out, the way some bad doctors would teach, okay? And you'll feel by turning this, you're stimulating all the joint mechanoreceptors, all the proprioceptive aspect of this, and all the muscles are going to tighten up. Now, would you want to adjust over a tight body or something loose and mellow? I'll give you a hint. Loose and mellow is better. Okay? In an aggressive attitude, you might want to do it tight. But this, no. Let's make it easier on you, easier on the patient, and more effective. So think of it. You've done the force loading in this posture. You've done the force loading in the other. And all of the adjustments are designed to change the brain's awareness of itself. Then you do it in the supine position. So the same exact force loading in this. And then you have to clear the other components. What other components? There might be a loss of curve in the neck, forward head carriage. There could be an alteration in mechanics. So you have to restore the biomechanics of the foot. Do you know how many people with a messed up back or lumbar spine have beautiful flexion of the foot, dorsiflexion? I ain't never seen any. I mean, I'm thinking, no, to be honest, probably about 3 or 4 in about 20 years, and they were all like yoga people. Okay, but typically if you have that type of flexibility, you're not going to have that type of issue. So we actually give restoration exercises to restore that normal dorsiflexion of the foot. We'll give a trochanter support to stabilize the pelvis, because pelvises are typically unstable. And if you're going to an osteopath or, a physical therapist or chiropractor, and you get adjusted and you say, wow, doc, that felt good, but by the time you get home, it hurts. Guess what? They're probably not adjusting the right place, or they're not stabilizing the pelvis. Okay, so look at it. So we'll give a trochanter support, give exercises. Now, what kind of exercise is my daughter-in-law doing there? She's creating a negative pressure on the front portion of the spine. Doesn't that make sense? It really does. So we came up with 7 questions for a corrective chiropractor. And I actually had a chiropractor from Chicago who'd been on the, chiropractic board for like 30 years. And he was pissed because one of my patients came up to him and said, I got this chiropractor in California that gave me this. And he says, you're telling me that if I don't answer yes to these, that I'm a bad chiropractor? And I said, well, gee, doc, let's look at these. If you're not taking an x-ray, because the first one is, do you take an x-ray? Then you're working blind. Yeah, you probably do suck. Okay, do you get listings off of your x-rays? Okay, if you're not utilizing the x-rays to justify your care or to help you guide your care, then why are you taking them? To bill insurance? Then that means you're a scam artist. Do you take post x-rays to document structural changes? If you are doing this, that's a real big level of skill. Because how would you like to take an x-ray and not show changes? Go on. Oh! Okay, so you gotta guarantee results with this stuff. This is a big deal. Okay, are your treatment goals to reshape and restore natural curves? That means if you restore the natural curves of the body, eliminate the lateral deviations, this person is going to live a longer and healthier life. Are you familiar with correcting disc injuries? You better be, otherwise you shouldn't be here. Do you work on post-surgical patients? Now you're talking, it depends on the statistics, but it's between a 75 and a 98% failure rate on back surgery. So if you cannot work on a post-surgery patient, what do they tell everybody in chiropractic college? The number one thing to do, there's no students in here, refer out. Okay, to who?
The medical doctor.
What are they going to do? Oh, put them on opioids. Put them on opioids. Okay, that's a good one. There is nobody to refer out to. Once the surgery has failed, you got to look at the biomechanics. I mean, doing this stuff for, I think, 23 years now, I've referred 5 people for surgery, and I really think 4 of them needed it. Okay, honest to goodness. So surgery is needed sometimes, but very rarely. Now, here's the MRI, and this is where a lot of doctors get mistakes. And a lot of people will come up and say, look, I had a disc injury. Okay, it showed up on the MRI 5 years ago. And I said, well, okay, the MRI is inaccurate, and have you ever cut yourself? They'll say, yeah. I said, well, did the cut heal? Yeah. And I said, well, disc is living material. If you had a disc injury, it may have healed. Your body may have adapted. It's living tissue. Don't own it. And plus, too, the MRI is inaccurate. The position it's taken in, according to the Clinical Radiology Journal 2008, the position that they're in and inflammation distorts the picture. So don't look at MRI like Moses came down with the 2 tablets and an MRI, It's direct from the burning bush. However, image findings often correlate poorly with clinical findings. No kidding. I mean, you got the difference between laying down or standing up. The problem with this is inflammation distorts the picture, and it's not giving you as much detailed information as bending one side and bending the other. Plus, when you have a back pain, should you look at more than just the low back where it hurts? Yes or yes? Obviously. But that's in normal world. Okay? Only because what you're looking at here is a completely unstable disc. Now, can you correct that? Possibly. But you're only going to be able to see the real cause by doing a dynamic stress x-ray. Discs are alive. They will regenerate if you restore the movement, the nutrition, the biomechanics, everything. Because discs get their nutrients through movement. Now, I had an orthopedic surgeon with a reverse curve in his neck. And I said, he had numbness and tingling in his hands. Orthopedic surgeon, do you think he wanted to operate on his neck? No. His hands are important. Okay? This is how he pays back his student loans. So I said, yeah, doc, luckily you got a reverse curve, but, on the good side, when you bend your neck, it moves. It can get corrected. So we have to regenerate the disc. Regenerate discs. And I said, yeah, it's living material. Regenerate disc. And I said, doc, okay, is it alive or dead material? Are they living cells or dead cells? I never really thought of it. Okay, doc, if they're alive, okay, they have to take in nutrients, produce proteins, eliminate waste products. Does that make sense? Well, yeah. Okay, if they're alive and they have to do that, can we increase their metabolic activity so they could regenerate? I never really thought of it. Do you know why? Because what's the number one drug you're going to give somebody with pain? I mean, before opioids. Let's start little. Non-steroidal anti-inflammatories. I totally agree. Even though that destroys proteoglycan production, which is the building block of cartilage, it damages the kidneys, increases a ton of different problems. We're talking gastrointestinal bleeding. So you're given a drug to make somebody feel temporarily comfortable, but it's destroying the body's ability to regenerate tissue. So if this is the standard medical protocol, they will never, ever, ever see it regenerate. Why? Because they're stopping the regenerative process. Spinal decompression. Okay, I would not recommend this for any American. Wait, you're not going to say why? Well, it's a drugged, sick population. How would you like to invert and have sick, drugged, we're talking bad diet, medication, and increase the pressure in the brain? Bad idea. Okay, and then when you look at the standard traction devices, that patient that I just showed you, okay, did they have a straight up and down spine? No, they didn't. They had a bend in it. Okay, does that make sense?
Yeah.
You saw it. Okay, so to get this straight, you have to push in this direction, and this direction. Okay, does that make sense? That's only doing axial force loading, so it doesn't work. It'll work about 30% of the time. I mean, it's kind of cool. The tables, you can bill insurance a lot, but you're not going to do a post x-ray on this because you're not doing multiple three-dimensional force loading. Now, this is the worst thing you can possibly do if you have back pain. Because what happens when you're laying on your back, okay, remember, a back is supposed to have a curve. That means that the disc spaces should be narrow at the back where the nerve is and wide at the front, okay, in a curve. Now, when you flatten this out, and this is why if you have back pain and you're laying on your back with a pillow underneath your legs, this is really bad, okay? But when you're laying on your back, guess what happens? You lay on this, you lift your pelvis up, and all the holes where the nerves, they're called intervertebral foramen, the holes where the nerves open up, so it feels amazing. But what just happened to the discs? Instead of being wide at the front, narrow at the back, now they're wide at the back, narrow at the front, so you're reversing all the discs. So then after laying on this torture chamber, okay, when you feel really good, you go to get up and you're a little stuck, but it feels really good. That's why you want to focus in on restoring the curves. This is why we use, can you grab a foam piece? We use a foam piece. We used to use a rolled up towel. You can use a water bottle, a liter water bottle. And where this is placed is the bottom of the elbow, is the bottom of the water bottle. And it's placed horizontal. Typically, you're going to place it for 20 minutes. And that means 20 minutes in, 10 minutes out. 20 minutes in, 10 minutes out. And this is going to be one of the rehabs. This is how you turn sitting into therapy. I know. So you get pilots, you get office workers, truckers, all of that stuff. You put it back there for 20 minutes, take it out for 10 minutes. 20 minutes in, 10 minutes out. Is anybody curious why it's 20 minutes?
Why?
Because I said so. No. Biomechanics. I always wanted to say that, man. You know, we never do grow up, okay? Okay, human tissue, when you put it under a force loading, it retains its original shape, okay? That's how beings work, okay? That's called an elastic deformation. However, human tissue, if you put it under a great enough force load for enough time, and that force loading has to be there for 18 minutes, that's called a plastic deformation, and it retains the new shape. This is why you see on every TV commercial, you only got to exercise for 20 minutes a day. Where do they get the 20 minutes? Human force loading. So instead of telling people 18 minutes a day, which would confuse them, I say 20 minutes in, 10 minutes out. 20 minutes in, 10 minutes out. So what does that do? It causes an imbibratory process, and it works. Seats that you can move on, like a ball chair, is also a good idea. Movement is fantastic, okay? But you have to get the body working correctly first. Now, the stabilizing the pelvis, we have a whole video on pelvic stabilization, which I totally recommend. but the trochanter support is ideal. The girl on the right there is sitting like a cowgirl with the legs out wide. Why does that work? Because you're getting the legs out wide, and that approximates the pelvis and takes a lot of the stress off. It works really, really well. So let's look at this. And so that's how you correct the low back. If anybody has a better, faster method to do it, please contact me. I will change my protocols. If not, send me your protocols. I'll learn them if it's better. If not, try them. Every doctor in the world is welcome to come by. You got to talk to my office manager because we can only have 2 docs here at a time. Okay, does that make sense? Okay, now let's delve into the world of crazy. Okay, chronic pain affects about half of the U.S. population. I think it's probably a little bit more than that. Purdue, the makers of a lot of the opioids, okay, the Oxycontin and things, in 2001, before Congress said, addiction is not common, addiction is rare in the pain patient who is properly managed. With many doctors convinced the drugs pose few risks to prescriptions, skyrocketed, and so did addiction. Few risks. Now, this is the world. Now, that was back in 2001, before the opioid crisis. And again, this is such craziness. Why could you call it an opioid crisis instead of the failure of the medical system to find the friggin' problem and fix it? Okay? You're right. Too many words. Okay? Opioid crisis is great because that way we don't need to look at the crap that they're doing wrong. Okay? We'll just say it's a bad opioid. Okay? But at least they're not addictive according to Purdue. Okay, so now the World Health Organization, this is out of 2012, Access to Controlled Medication Program component, developing the World Health Organization on guidelines for pain treatment. Now, this is really important. It really, really is. Like when I was run over by a car, and this is about 30 years ago, run over by a car, both my legs broken, my sternum fractured, my skull fractured. Thank God for morphine. Because I hurt, and if anyone's ever been in a trauma like that, they don't know if they're going to have to knock you out. So they're moving your body around to shoot x-rays of it to see how many parts are broken. And they don't drug you before they move you around. Okay, so it hurt bad. And when they gave me the morphine, it felt great. So I'm not opposed to morphine, okay? I had 3 shots of it. I was scared to get the 4th shot because I thought I was an addict by that time. You know, it was day 2. And I thought, no, I really need a shot. And I didn't. I just wanted that feeling. So I got scared and I never had it again. But let's look at this. This is the World Health Organization, 2012. There is a need for greater awareness among policymakers, healthcare professionals, and general public to dispel the fear that opioid analgesics, such as pain relievers derived from opium, such as morphine, will produce harm to patients and society by causing dependence. However, the fear of the risk of becoming dependent upon medical treatment is unfounded. Okay, now, thank God someone's laughing because I'm looking at this and I'm going, it can't say what I just read it to say. You know, we got an opioid crisis and we're trying to export it to the rest of the world because they're okay with it. Okay, now, U.S. represents about 4.5% of the world's population. We use 99% of the hydrocodone. Why would we want to share it? I know. Okay. So it's interesting. So I go to the drugabuse.gov site. And again, this is not a Saturday Night Live episode. This is a website by the government. How did this opioid crisis happen? They state, in the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This subsequently led to widespread diversion and misuse of these medications before it became clear that these medications could indeed be highly addictive. Okay, so 2017, 47,000 Americans had died of an opioid, heroin, illicitly manufactured fentanyl. 1.7 million suffered substance abuse disorders, and 652,000 suffered heroin use disorder. So now that's bad. So what do you think? I want to cover it up with my hand, but I can't, okay? What do you think the solution was? Okay, now remember, the drug companies lied to the American public, they lied to all the medical doctors, nobody got arrested, and they made billions of dollars in profit. So what they're going to do, since the market is pretty much saturated because everyone's stoned in America, we're going to bring this out to the rest of the world. Why should we hoard 99% of the hydrocodone? We should spread this around. So what is Health and Human Services and the National Institute of Health going to do about it? Well, they're going to improve access to treatment and recovery services. Boy, that's good. We're going to promote the use of overdosing reversing drugs. So this drug caused it, but by God, this drug will help you. I'm telling you. Strengthening our understanding of the epidemic through better public health surveillance. How many people are really stoned? Okay, providing support for cutting-edge research on pain and addiction. Cutting-edge research? How about looking for the cause? I don't know. That makes sense. Respecting human beings like they're given a symptom for a reason, and advancing better practices for pain management. How about finding the friggin' problem? Okay, it's just mind-blowing. Okay, now Vioxx. Vioxx, we know, licensed in 1999, and this went through about 6 years of testing. The double-blind placebo-controlled trial was approved, killed a bunch of people from heart attacks, was pulled in 2004. And some people say between 60 and 100,000 deaths, but they did make a profit on it still. Now, they've exported this now because Vioxx is no longer available in the drug country of America. I had a phone consult with somebody from, I think, Bangkok or someplace, okay? It was someplace, India or Bangkok, and they're taking Arcoxia. And I thought, wow, I never heard that one before. So before I get on there, I look it up, and it's Vioxx, but under a different name. So it may have killed people in this country, but we're exporting it to the rest of the world. Now, this was back in 2003 in the Journal of Spine. I just threw this in for the heck of it. They were comparing a chiropractic adjustment to Vioxx. This was before Vioxx was pulled, and it turned out that the chiropractic adjustment worked better. Yeah, with no negative effects. Here's the non-steroidal anti-inflammatories that they give. What does it cause? 60% increase, cardiovascular problems, GI bleeding, congenital heart failure, allergic reactions, 80% risk of miscarriage, and heart arrhythmias, atrial fibrillation. What about Tylenol? Emotional issues, toxic epidermal necrosis, which means that skin just starts to rot on you, decreased cartilage production. Decreased cartilage production. Hi, this drug will make you feel better while your body rots. Okay, so we know the institution across, this is the Journal of Law and Medical Ethics. They're saying the pharmaceutical industry has corrupted the practice of medicine through its influence over what drugs are developed and how they're tested and how medical knowledge is created. This was like 6 years ago, and I'm reading stuff currently, how medical knowledge is created. We're exporting a highly addictive substance that's completely ineffective for correcting the problem that it's prescribed for. And it causes a huge amount of other problems, like death. How many people have recovered from death? Christians will say 2. One had help. Okay? So we look at this, and it's like, that's hard to recover from. Okay? So you look at this. The opioid addiction of America. Now, in 1999, the sales have quadrupled. Okay, quadrupled. That's gone up 4-fold. But pain hasn't increased. When you do surveys on it, it's just better. So let's look at surgery. So when we're talking about back pain, and I'm talking about crazy, wild, radical stuff, like how about taking an x-ray and a stress x-ray of the entire body? How about looking at the biomechanics of the feet, the knees, the hips, the pelvis, the head, the forward head carriage? How about looking at proprioceptive responses by bending that person one way, bending the other way? And how about doing in a post x-ray to document the actual things that you're correcting. Okay? That's radical. Now let's look at the cultural authority of surgery. Okay? And this is out of the journal Surgery, the Ultimate Placebo. There's very little evidence that spine fusion surgery for back pain is effective. It's very expensive, leads to complications, further surgery, and increased mortality. I don't know. Let's see what the Journal of Spine has to say about spinal surgery. Although there are multiple surgical options for the treatment of chronic low back pain, there is currently insufficient evidence which to draw any firm conclusion as to their effectiveness or clinical outcomes. Wow. The chance of permanent disability increases over 500% with surgery compared to no surgery. So it turns out that no surgery is better than surgery. Am I, okay, I gotta have a sick sense of humor. If I'm reading this stuff and I think this is funny. Okay, so let's look at the Surgical Neurological Journal, 1998. Failed back surgery syndrome. Now, a surgeon will say they have a 98% success rate, and that's true. That's true. But they're not looking at pain. They're just looking that they knocked the person out, did the operation, woke the person up. We got a winner. Okay, we're not going to follow them for 4 or 5 years or see their mechanics or see if there's any altered function. They made it back. Okay, pain reduction for a single level fusion, it's between 40 and 80%. But again, this isn't watching them for years. It's just looking at the immediate results. Pain reduction on 3 levels, it drops down to 15%. If anyone's good at math, that means an 85% failure rate. Then we go in, the overall success rate drops to 74% if you talk about if they can go back to work. For workman's comp, it's 29%. So that means a 61% failure rate. And this is to something that's not good. But back surgeries are going up. They're going through the roof. I mean, not only have they increased in expenses or cost of surgery triples, but the number of surgeries are going through the roof. Why? Because the opioids don't fix back pain. Why would they? How could you ethically or morally prescribe a drug when a human being is giving you a symptom and you can't even take an x-ray to find it? Heck, you can't even read it. And that sounds like I'm belittling that profession. No, I'm not. Because I had one of my first patients in a medical doctor office open next to where I first started in practice. And I went over to introduce myself. They were introducing me, and they gave me this 42-year-old gal with carpal tunnel syndrome. And I said, dude, I can fix that. Okay, it's coming from the neck. 42 years old. She couldn't have really bad degeneration. Sure enough, she had a reverse curve in the neck. Now, if you know that carpal tunnel syndrome is a double crush injury causing compression of the nerve here, leading to a muscle imbalance here, flattening out the carpal arch, compressing on the median nerve. So it's a double crush injury beginning from the neck. So I go back to the doctor after about 3 months, and I said, hey, I got some good news on that patient you sent me. Yeah, who? And I said, well, Marie, the gal with the numbness in hand. Oh, the carpal tunnel case. Yeah. Okay, so here's her before x-ray, here's her after x-ray. And I actually made a poster out of it. Okay, you can see it in the rooms back there. Reverse curve and restored curve. And they're looking at it, and they're going, what's the difference? And I'm realizing that they're not taught to look for a normal or abnormal position. Because when you see a reverse curve, there's no tumors, there's no fractures, there's no pathology, just like on a normal curve. But if you're not taught to see a mechanical distortion and know that you can correct that mechanical distortion, you're not going to be trained to look for mechanical distortions. Does that make sense? Blew my mind. It was just incredible. Epidural. This makes a lot of sense. You have back pain. We're not going to assess where it is. We're going to do an MRI, which is ineffective. We're going to lay it down. And now we're going to put a needle in there to inject some substances which will shrink the swelling of the tissue, increasing degeneration. Does anyone think this will correct the problem? No. How could it? Where's the common sense? It's mind-boggling. What about muscle relaxants? That's another good intervention. Studies did not provide evidence for long-term use of muscle relaxants. That's a central nervous system toxin. Muscle relaxants demonstrate more central nervous system side effect compared to placebos. The Journal of Spine. What about electric modalities? Although electric modalities and physical agents are frequently used in management of chronic low back pain, few studies found to support their use. TENS doesn't appear to have an impact on perceived disability or long-term pain. What about interferential current? Now, this is one of the courses that I taught. We taught interferential, we taught DC, we taught every type of electrical modality you could. And electric stim, no eligible studies. Interferential current, no eligible studies. Ultrasound, no eligible studies. Hot pack, cold packs, ice, no eligible studies. So this means most of the therapies that people do don't work. Here's a 19-degree bend down to 12 degrees. Pre and post x-rays, body's still got a problem. But what's weird is his blood pressure went away, his knee pain kind of went away, is still there a little bit. He was able to sleep. His bowel movements went from one every other day to actually one a day, which I'd like to see 2 to 3 a day, which would be normal. But that's cool, isn't it? So now let's look at what an anti-inflammatory is. Okay, what's the difference between Motrin, Aleve, Advil, Tylenol, or turmeric root and green veggie juice? Inflammation is from tissue damage. Inflammation is the healing process. If you have tissue damage, that's going to inflame so your body can lay down new material. Okay, does that make sense? Now that process is called an oxidative metabolic process, which creates free radicals. So sometimes that breakdown process can affect healthy cells. So if you take things with antioxidants, this means plants. Okay, this means turmeric, blueberries, papaya, sweet potatoes. God, those look good. Green veggie juice. Okay, yeah, this is my fast state. That looks really good, honest to God. Okay, so you have that. If you eat something with antioxidants, they can give up electrons and they deactivate those free radicals. So when someone says, hey doc, you're causing inflammation, absolutely. We're increasing the metabolic process of that area, regenerating tissue. Well, then why are you telling them to drink a berry smoothie or have a green vegetable juice or take vitamin C? Because I want that process to be effective in regenerating tissue. Does that make sense? These are appropriate anti-inflammatories that are going to facilitate the healing process, which is inflammation. Water, fantastic. It works. Drink it. But it has to be healthy water, not the fluoridated, chlorinated stuff that we're exposed to. Fish oils, deep breathing. Look at the Wim Hof method of breathing. Fantastic. We just talk about in through the nose, out through the mouth. In through the nose, out through the mouth. It works. Okay, and this is on your handout, a bunch of little tiny things that you can use. I'd rather have you just stick with organic plant-based diet, healthy fats, nutrients, but this is literally how to maintain your health. Healthy nerve supply, regular exercise. This moves the body and helps everything work. Proper nutrition, sufficient rest, and prayer and meditation. That makes sense to me. Opioid crisis? No, it's a medical failure. Now, we have a number of speakers. The Extreme Health Academy is out of this world. I totally recommend you go there. But also, the cool thing about Extreme Health is it's a community. If you've had fibromyalgia or multiple sclerosis or some type of cancers, I guarantee you there's somebody in those forums that used to have those things that recovered. We just redid the Dr. John Bergman site. Wait till you see the articles. I've got this one writer who is a genius. He is a retired engineer, and he is just a researchaholic. I mean, I know he's a brother from another mother. Now, let's make a difference, okay? Because the information that we're presenting here is challenging the status quo. It's challenging those in cultural authority. But if not, if we don't make that move, that push, if you're not bold, your friends and relatives are in that system that's killing them. Okay? And that's just wrong. Even if you don't like them. Okay? Let's take care of them. Because they might just be grumpy because they're on opioids. Okay? Thank you very much.